Hi, everyone, and welcome to the very first episode of The Other Half of Health. This podcast is all about uncovering the gaps in women's health, the things that don't always get talked about enough, whether it's how our symptoms are dismissed, how culture shapes care, or how mental and physical health overlap more than we realize. Each episode will dive into a different topic, from hormones to chronic pain to eating disorders, and talk with experts who can help us understand why these issues matter and what we can do about them. Today, we're starting big, an overview of the biggest challenges women face in healthcare right now and what needs to change. So, let's get started. So for today's episode, I'm honored to welcome Dr. Rajiv Dina Diallo, a board-certified OBGYN, someone deeply committed to combining medicine, technology, and patient advocacy. Thank you so much for joining us here today.
Yes, thank you for having me.
Yes. So let's dig into some heavier topics. So I like to begin by asking, what first drew you to women's health and obstetrics/gynecology, and was there a moment or influence early on that shaped your career path?
I think most physicians that pursue obstetrics and gynecology probably had some inclination to want to do something surgical in the first place, and that was me. I thought I was going to do something in the general surgical field, and then the OBGYN rotation was my second to last. And being in the delivery room was really an exciting location for me. I mean, there are very few personal moments that you get to be part of. One is the birth of a child, one is your wedding, and we get to do that. And so being an OBGYN, you have some operative experience. So you're in the operating room, you're in the office, you're in labor and delivery. So there's a little bit of variety every day. So that's what drew me to the field.
Yeah, that's amazing. And as you built your practice over the years, what sustained you and what keeps you inspired in this specialty?
Yeah, so I've been in practice for 27 years, and I have two patients currently that I delivered that are now pregnant. So you get these longitudinal relationships where people really do trust what you have to say because you built up that credibility with them over time. So it's earned over time on both sides.
Yeah, that's really great. Your profile also mentioned that you specialize in minimally invasive surgeries, using like a robotic system. That's really fascinating to me. Could you please explain for our listeners what exactly robotic gynecological surgery is and why it matters, especially for women who might be facing heavy procedures such as like hysterectomies?
Sure. The technology was really a breakthrough to allow us to do things that otherwise it would have required an open incision to handle. So the robot sits away from the operative table. So as the surgeon, I am sitting probably 10, 12 feet away, the patient's on the table, and the robot is connected through cables through the console that the surgeon operates with. So just like I maneuver my hands, turning a doorknob or bringing a newspaper closer to me, when we make those maneuvers, the robotic arms mimic those same activities. So we get to accomplish things that otherwise would have required a 5 or 6 inch incision through an incision that might be a centimeter to a centimeter and a half. So it improves recovery, less pain, return to work is quicker. It just provides a better option for folks.
Got it. So from a patient's point of view, it sounds like less pain, quicker recovery, and smaller incisions. But do you ever see any sort of resistance or like skepticism around robotic or minimally invasive methods in your field, and how do you address that?
So that probably would have been a more pertinent question 20 or so years ago when we launched the program, because it was new. It's based on the same operative techniques, but because it was new technology, there was always a little bit of hesitation there. So I remember for the first 20 cases that I did, I would tell people, you're number 1, you're number 3, you're number 8, because I felt they needed to know that information. Because if they didn't want to proceed with it based on it being new, then they had the right to be able to say that. So I felt I needed to tell them that. And I didn't have anybody who said, nope, I want to do it a different way. They said, if you're trusting of it and you think it's good, I'm good with it. And I think that goes back to the development of the trusting relationship that we have in this field.
Yeah, definitely. And having practiced for many years, you must see a lot of issues that don't nearly get enough attention. If you had to choose 3 women's health topics that or conditions that you feel are severely underdiscussed, what would they be?
I think there's more than 3 that you could probably put on that list, but I think the top 3 would be sexual dysfunction. There's a hesitation to divulge personal information. One would be urinary concerns because people are embarrassed. And I think the third is related to transitions that happen over time as a woman goes from her 30s to her 40s, 40s to 50s and beyond. There are natural body changes that take place that sometimes they don't feel good about. And so they have a hesitation to bring that up.
Yeah, definitely. Do you think a part of the problem is that women's symptoms are often too easily dismissed or normalized too early? And could you share an example, such as like a case or scenario where something serious was misinterpreted as normal until later?
Yeah, I think that can be the case. And so there's two ways of that occurring, right? Either somebody is kind of dancing around the real subject because they're embarrassed or they're inhibited to be able to talk about it, or they do talk about it and there's maybe unintended or intended comment that comes across the wrong way and it really makes that person feel like they can't open up, And so there are times where younger patients may come in with certain symptoms, and just by virtue of the fact that they're young, statistically, they don't really have a higher potential of having something serious going on. So it may take 2 or 3 visits before you get to the point where you say, yeah, you came in 6 months ago, you've got a big ovarian cyst. And because you were young, we didn't think that was going to be something that would happen. So there are times when that happens, but it's really important to listen to what the patient is telling you, because many times when there is something that is going on, there will be a few distinguishing features in their history that can help you realize, this doesn't sound quite normal. So I think there are times when that can be dismissed, but it takes a mutual understanding on both sides.
Yeah, and building on that comment, a lot of women, I feel, grow up believing that stuff such as irregular periods or pain during sexual activity or mood swings are just part of being female and they're sort of normal, and not something worth bringing up to a doctor. How do you help your patients distinguish what's expected versus what's a red flag and what they should pursue further?
Yeah, I think this is somewhat where being a male in the field is very advantageous. A lot of times people say, well, a male in the field, people don't want to see you, but I've never been through any of those experiences, right? I've never carried a child. I don't know what that feels like. It doesn't look comfortable. So when people tell me that they're having X, Y, or Z symptom, I take that at face value because I'm not walking in their shoes. So I think the biggest question that I ask whenever people voice any sort of concern is it interfering in your quality of life? And everybody's got a different definition of what that would be, right? So some people say, yeah, this is a bother, but is it bothersome enough to do something about? No, I'm not there yet. Then we set that as the baseline and we say, if anything changes, whether it's 6 months, 12 months, or 18 months, we revisit the topic, versus those that say, yes, this pain or these heavy periods or these irregular periods, this pain with sexual activity, it is inhibiting my quality of life to the degree that I want to enjoy it. Those are times when I say, okay, now we look at treatment options rather than just observation.
Right. And in your experience, what's the single symptom or pattern that women tend to ignore the longest, and why do you think that happens?
Yeah, I think, it could be a few things. I think pain is probably one of them, especially when it comes to sexual activity or their periods, because they kind of just feel like, well, that's just normal. People have that and I'll just deal with it, or I'll outgrow it. Or yeah, after I have a child, maybe the anatomy of the pelvis changes because of the size of the uterus and it'll just get better. So I think that's what people, human nature is you tend to rationalize things. And I think the longer something goes on without a remedy is when people really start to say, okay, I need to go see somebody about this.
And as we know, women's health doesn't just happen in like labs or operating rooms, but things like stress, trauma, mood, play huge roles as well. Do you incorporate or encourage mind body or like other integrative methods in your care? And could you share a case where maybe some holistic approaches made more of a difference?
Yeah, I think a big one that comes to mind there is the transition in menopause, because not everything needs to be treated with medications or a prescription, right? There are certain times where acupuncture or behavioral therapy or maybe trying some natural products that might remedy some of the severity of the symptoms, or even trying compounded products. So I think that's one of the things that maybe, and somewhat of this is generational, right? Older physicians maybe don't have as much experience with newer modalities or newer technology, so we tend to be a little bit more in the traditional realm, whereas maybe younger folks might say, I saw that on Instagram, or I saw a write up on this, and they might be more in tune with prescribing things that are non-traditional. But there's definitely a connection between mind and body and how you feel whenever assessing a certain symptom.
Right. And kind of elaborating on that point about menopause, do you feel that the medical community gives enough attention to midlife and menopause in the same way that we stress youth and fertility? And why or why not?
Yeah, I think some of this goes back to comfort or discomfort level with initiating treatments, right? There was a big women's health initiative study that came out about 20 years ago that really kind of took hormone replacement therapy and pulled the rug out from underneath it and really made people very cautious and somewhat scared to continue their treatment. So I remember that time we got a bunch of phone calls for people wanting to stop it. And we said, sure, if you want to stop it, that's fine. And then about 3 months later, we got a bunch of phone calls that said, I'm miserable. I can't do this. I need to go back on it. Right. So it's all about improving quality of life.
Right, that makes sense. And especially since you've been in this field for so long, I'm sure that you've noticed and experienced that culture, gender norms, shame, and silence are huge in how women perceive and prioritize their health. In your experience, how do cultural or generational attitudes influence whether women seek care, speak up, or even trust their own symptoms?
Yeah, I think it plays a big role in that. Culturally, there may be certain aspects of a certain heritage that just engender more of a feeling of I'm not a complainer, I'm not going to deal with this, it'll go away on its own, or I'll just have to find a way to overcome it. And that's sad because we do have options for treatment. It's just a matter of a person feeling comfortable and feeling like they're not complaining when there really is a legitimate issue going on. I do think this is where there is some generational advantage for younger folks because they seem to be more inclined to bring things up when they're bothered by something, and whether they might see it on social media or hear somebody talking about it, I think it strengthens their resolve to want to bring something up sooner rather than later. Most of society wants an instant answer for things right now, and I think the younger generation is a little bit more in tune with that, and there's a little bit less of a tendency to wait over time.
Yeah, definitely. In communities or populations that already there's like historically less access or trust in healthcare, what do you think providers and listeners can currently do to sort of dismantle those barriers?
Yeah, I think sometimes that takes a phased approach, right? If you come in right from the start, dictating care, telling people what they need to do, they don't want to hear that. They want to hear somebody who is listening to what they have to say, maybe repeats back what they have to say, maybe says, here are your options, think it over, and you come back in 2 months and let's talk about it. And if things get worse before 2 months, I can always see you sooner than that. So I've been doing it enough where I can pick up on those times where I think somebody's kind of thinking, I don't know if I buy what he's saying here. And so I'll put in a link in there after visit summary to say, hey, here's some information on this topic, or here's a QR code. Read it, research it. Maybe it's not for you, but maybe it is. And so you have to give them a little bit of flexibility and, most importantly, time to be able to accommodate to what you're saying to see if it's going to fit with what they need.
Yes. And as we sort of listen to all these various problems, if you had one overall message to every woman listening, something that you wish that she could internalize about her health, what would it be?
Well, if I had one message that I would deliver, it is take control of things that you feel are bothersome. However you define that, whether that's defined by a poor image of your own body as it's transformed over time, whether it is, urinary leakage, whether that's the first time that it happens, or whether you say, like, I'm having to change pads multiple times, whatever it is, if it's a bother to you, that's enough of an issue that should be brought up. And I think just taking control and sometimes just feeling comfortable with some of those vulnerabilities, I would encourage people to say, and if you do bring them up and you don't get the answer or the response that you're looking for, find somebody else. Just like if you didn't get treated well at a car dealership, you're not going to go back there and buy that car, right? You need to have a positive experience because it is going to change your overall approach to how whatever treatment modality is recommended, and more than likely will influence the success rate as well.
Wow, yes. Thank you so much, Doctor, for sharing this wisdom and being here for our first episode. I truly can't wait for our listeners to hear this and feel seen.
Yeah, thank you. It was my pleasure.
To everyone tuning in today, thank you. If you gained something from today's conversation, please subscribe, share, and tag someone that you think would benefit from hearing this. Next episode, we're going to dig into eating disorders and nutrition in women, a topic so often misunderstood and stigmatized, and one that I'm personally very passionate about exploring. Take care of yourselves and always each other, and until next time.